Hello everyone, this is me, Dr. Rukmani. Topic is Scleroderma. So we will be talking everything about Scleroderma, like what are the causes for it, what are the signs and symptoms, what problem you have, what are the diagnostic step, diagnostic criteria for it, and what are the complication if you don't treat this problem, what complication you can have, you can develop, and what are the treatment available, how you can avoid this problem, how you can manage this problem, and what are the treatment available. We will be talking about allopathy mode of treatment, and lastly the best effective homeopathy medicine to treat Scleroderma. Requested to watch complete video for gaining complete knowledge, complete information. Don't skip the video, watch complete till the end for getting more information. So let's start. The first definition. What is Scleroderma? Scleroderma, as the name says, sclero. See, sclero means hardness, thickness, thickening, and derma means your skin. So this is the kind of disorder, this fall under autoimmune disorder or kind of an autoimmune disorder in which you have skin hardening, skin thickening, or this affects usually on skin, but it can affect the system as well, like your kidney, your heart, your lung. So this is a autoimmune systemic sclerosis, right? So what are the autoimmune disorder? If we have our defense system, our immune system, but if your immune system mistakenly attacks your own tissue and damages them, without differentiating them with the foreign bodies, so this fall under autoimmune disorder. This is a long-lasting disease. And is it contagious or infectious? No, it is not contagious, not infectious. So what do you mean by infectious or contagious? See, contagious or infectious diseases are that can transfer from one person to another, but this disease cannot transfer from one person to another. This fall under autoimmune disorder. So let's talk about the types of Scleroderma. What are the types of Scleroderma? See, if we talk about in a broad way, there are two types basically. One is localized, that limited to your skin, and another is systemic, we call it. So in localized, further we have morphia and linear. See, morphia usually affect your skin, and there are elevated oval shaped patches, red patches can be there. Ultimately their center can become white, and there is a thickening, there is a shiny appearance on your skin you have, that is called morphia. Rarely that can affect your inner organs as well, your internal organs. In localized, further we have linear. So as the name suggests, linear means there are the thickening, there are the elevation, sclerosis, hardening on the skin in a linear pattern. So you have now the systemic, as the name says, that affects your whole system, whole body. This further categorized in two parts. So one is limited and another is diffuse. So in limited, you have slow onset, means you are having symptom, you are having disease, but in a slow pattern. The onset is slow, you are having problem with the time, gradual, that your skin, your extremities, your hand, your legs are affected. But in a diffuse, that the last one, the problem onset is sudden. You have all of there is a sudden Now the causes and the risk factors for the Scleroderma. See, there is no certain cause, there is no single cause for Scleroderma. There are the risk factors that blamed for Scleroderma. So if we talk about the risk factors, if you are a woman, there are more chances, you are more prone to have this problem. If we talk about the age part, if you fall under 30 to 50 years of the age bracket, yes, there are more chances. If you had certain kind of chemotherapies, yes, there are chances. If you had exposure to salicylic, if anyone in your family had history of Scleroderma, then you can have this problem. So these are the risk factors. There is no certain cause, and it is believed there are certain theories that there are some changes in the genes. So genetic. Talk about the sign or symptoms, what suffering you have while you have Scleroderma. See, sign or symptoms, your difficulties will be completely depend on the types of Scleroderma, that what types of Scleroderma you having, and the severity of your case. So it will be completely depend on your case. If it is related to the skin, then there can be skin hardening. There can be, we already discussed that in morphia there can be elevated oval shaped skin patches, there can be and redness, shiny appearance, or there can be red small spots on your skin, and there can be scarring. There is a hardness, scarring on the skin, and as well as your internal organ, like on your lungs, your kidney, they can be scarring. So esophageal problem. There is a type that we discussed in systemic sclerosis, limited one. There is a syndrome that is called CREST syndrome. So CREST denotes C for calcinosis. If you are having high calcium deposits, you can have on your skin. And the Raynaud's phenomena is usually affect women, and there is a lack of blood circulation in their fingertips or toes, and the area is red, or it can be turned purple and blue. There is a poor blood circulation in the affected area, so there can be Raynaud's phenomena. And E for esophageal dysfunction. You have problem in your swallowing, difficult swallowing there. So these are the esophageal difficulties. For sclerodactyly, see sclerodactyly, again the hardening of your fingers. And the last one is telangiectasia. Telangiectasia are the new blood vessel growth on your skin. So these are the problem you have in systemic sclerosis, and these symptoms can affect if you have systemic sclerosis under your limited one. You are having limited one, then these problem can be there. We specifically describe these because you can have any of the problem, and you can your symptom will completely depend on the problem you have. So if you talk about the stomach part, there can be belly cramps, there can be loose motion, there can be diarrhea. If you are having your stomach problem, there can be kidney problem, there can be lung problem. If you have problem in your lungs, there will be difficult breathing. So this affects usually as a whole or systemic. That's why your heart problem can be there. And if the sclerosis of the blood vessels means the vessels that carries your blood, if there is a hardening of the blood vessels, there can be high blood pressure, right? So the symptoms completely depend what organ is affected and how severe is your case. Now let's talk about the diagnosis part. Diagnosis means what tests are required to diagnose. First is your complete case, taking complete case analysis to be done. Chest x-ray, your CT scan of the chest can be done, basic blood test can be done, your ESR can be done, RF factor can be done, and your pulmonary function test, PFT, or we call it a LFT, lung function test, can be done, and your EKG can be done, electrocardiogram can be done, EKG can be done, and ESR, pulmonary function test, blood function test can be done. So these are the tests required. Urine analysis can be done, and biopsy, if there are other cases mixed together, then biopsy, skin tissue can be taken and can be studied for the further evaluation. This is called biopsy. So this can be done. Complication, if you don't treat this problem, there can be a worse effect, there can be bad effect of the problem. So in complication, we discussed if there is a hardening of the blood vessel, then there can be the high blood pressure, so there can be high BP, and if your kidneys are affected, so there can be kidney failure. If your heart is affected, then there can be heart failure. So it completely depends on the what system is affected of your body. So your complication can be because of that. Management part, or what steps you can follow to avoid this problem. See, scleroderma cases are very difficult to complete cure, and it depends on these are the coexist with the other autoimmune disorder as well. So we call it mixed connective tissue disorder. So it complete case taking should be done, and management part is the most important. So healthy habits like doing physical activity, by adopting exercise and having a balanced diet, good diet can help you to lead a better life. Avoiding smoking help you with your treatment. So now let's talk about the treatment part. We will be discussing the first allopathic and then the homeopathic, best effective homeopathic medicine. See, you are having systemic, all system is affected. It will be again depend on your system in allopathy as well, that what system is affected. So medicine will be prescribed on the basis of your system. So usually NSAIDs, non-steroid anti-inflammatory medicines are given that can relieve your pain, that can reduce swelling. So these are the medicine can be given. Steroid can be given in some severe or critical cases if your internal organs are affected in allopathy. Now let's talk about the homeopathic medicine, best effective homeopathic medicine. In homeopathy, it will be completely dependent on your case as a whole, that what system is affected and what all symptoms are you having, more specifically what symptom you have. And so we are having some good medicine, some top medicine for scleroderma. Let's talk about the first. We are having Antimonium crudum. See, antimonium, these are the homeopathic medicines. See, it doesn't matter that what companies, you always just focus on the medicine name, that what is the main medicine, and potency can be 30 or 200. So wherever you belong, wherever different, but there are so many medicine in homeopathy as well. So you just name Antimonium crudum. So Antimonium crudum is given when there is a rheumatism and gastric problem. You are having rheumatism, there is a stiffness, you are having problem in your system, and there are the skin hardening, there is a thickening of the skin. So Antimonium crudum comes on the top of the list. So Antimonium crudum, you are supposed to use this medicine orally. This is the dropper. With the help of dropper, 2 to 3 drops twice or thrice in a day before meal. You are supposed to have regularly. Once you start feeling better, you can taper down or you can lower your doses, and otherwise you just continue your medicine for a longer period, like it can be 2 weeks, 3, 4, 6, or it can be even in months. So you're just supposed to continue, not supposed to buy all the medicine discussed in the video. You just buy the medicine related with your symptom or related with your system affected, what all symptom you have. Now we are having alumina. See, alumina in homeopathy is given in scleroderma, skin hardening or thickening cases, where you have gastric problem or bowel difficulties can be there. Same 2 to 3 drops twice or thrice before meal for a longer period of time. You are supposed to have this medicine alumina, one medicine at a time, depending on your case or according to your case. Now we are having Lycopodium. It is given in a systemic when you have bloating in your stomach. There is a symptom in systemic that there can be bloating, there can be cramps, belly cramps and belly bloating. So if you are having bloating or pot belly tummy you have, so you can use Lycopodium. Lycopodium 30 or 200 potency, 2 to 3 drops twice or thrice in a day before meal for a regular period of time. To start feeling better, you can decrease the doses of the medicine. Medicine should be continued. Now we are having petroleum. In homeopathy, petroleum is given when you have hard, thick skin and there are the cracks, there are the cuts on the skin. So if your case is that severe, then you can use petroleum. Petroleum again orally 2 to 3 drops twice or thrice before meal for a regular period of time again. And petroleum, we have ointment in petroleum in homeopathy, so you can use ointment. Now we are having silicea. So silicea is the medicine in homeopathy that can be used in systemic, specifically if you are having lung problem, if you are having sclerosis of lung, so lung hardening. If there is a case, then you can use silicea. Silicea is the medicine, very effective medicine. Again 2 to 3 drops twice or thrice before meal for a regular period of time. So all in all, in homeopathy, it depends on your symptom that what will be your medicine. The case medicine completely can be different from one to another depending on your symptoms. So this is how homeopathy differentiate. Dr. Rukmani drops. See, this is the drop form. If you are having been discussed in further type limited one, that you have CREST syndrome. So in CREST syndrome, we discussed about the calcinosis. Calcinosis means high calcium deposits. So if you have high calcium deposits, this medicine can be used. This is in the drop form. This medicine, if you are using, you can add some water, 2 to 3 spoon of water. The medicine doses will be 10 to 20 drops. You can mix and you can have it again twice or thrice. If your case is calcinosis, if you are having scleroderma of calcinosis, means you are having high calcium deposits, then you can use this medicine again for a regular period of time. So these are the medicine, oral medicine you can use for according to your case. Aloe vera calendula multi-purpose cream. So this is the homeopathic ointment, homeopathic multi-purpose. If you are having aloe vera calendula cream, you can apply because there is a skin hardening. So this the moisturizing of the skin. So let's brief in the last scleroderma, we discussed that this is the skin hardening, skin thickening. Why? Due to the high collagen production, there is an overproduction of the collagen, and collagen is a kind of protein that makes your connective tissue. So this is the high collagen production. So hopefully this video can help you. If you find this video informative, knowledgeable, you can share this video. You can share, you can like, and you can subscribe our channel. You can press the bell icon to get notified. Thank you for watching. Thank you so much.